research, as we do it, always pays for the user groups to be part of the research. And even for their training, all of our research is done in partnership with user groups. Everything is read by them, everything is redrafted if necessary. That's for the patient or to read. We're working together. In the United Kingdom, medical students can do a degree in a medicine-related discipline, and so I found one who was doing a bachelor's in neuroscience and one in psychology, and they interviewed patients under the supervision of a research assistant working with me, and they brought it together for their bachelor's degree, and then we brought it together for our publication. In the epilepsy project, a humanities person with an interest in autobiography interviewed the patients, and then a postdoc with a PhD in qualitative methods analysed the data and wrote it up for publication. So, and I was sort of working with all of them over the course of time.
Because we were interested in experiences, perspectives, beliefs, we used qualitative research methodology in this study. So it was a series of semi-structured interviews where we didn't have any numbers. We asked open-ended questions about people's experiences. The interviews were conducted at one point in time, so it was a cross-sectional study.
We were doing, in a way, like a survey, because there was one interview. And we know that people behave differently over the course of their illness.
We asked what people's uses of new media and online media were, and how this might impact the way that they present themselves.
One of the things we found quite difficult is to ask people about their sense of self-identity, if you like. And all the way along in interviews, for them to understand what that meant was quite a challenge. Even though these were, on the whole, highly educated people, it's a slightly recherché humanities concept, if you like, and without, or social science concept, because indeed Goffman was the sort of pioneer in describing stigma. So I think trying to explain what we wanted to learn to patients was sometimes difficult, or to users, I should say, because actually they were identified not through the health service. We weren't particularly looking at YouTube or any other, and there have been studies, reported qualitative studies of the use of some of these other technologies which complement what we're doing. So we weren't particularly looking at the visuals, we were looking at the verbals.
In healthcare research where we're interested in experiences, certainly qualitative research can uncover things that perhaps might not be captured by ticking a checklist box. So it provides more context and perhaps aids understanding of complex topics such as identity and self-presentation.
Even in terms of doing this kind of research, there's a self-selection bias again towards people who are reading and using English. So one has to be aware of that.